the radiation oncology has evolved quite a lot in the past 3 to 4 decades, in particularly, and more so it got galvanized in the past decade, that's in the 10 years. The more on the instruments, and it has really galvanized, and the point is we can really focus the radiation to the diseased part and spare the normal tissues, and we have almost mastered that technique. And in fact, if you've heard, we call it a cyber knife, the radiation. Now, the simple reason is to that accuracy, sub-millimeter accuracy, now we can treat the tumors using radiation. That's the way the radiation has progressed. That is now one part of the science development. But in addition to that, everybody has realized the science of oncology cannot be dealt by only one subspecialty. It is a multifactorial, and in fact, all surgeons, radiation oncologists, psycho-oncologists, nursing, and everybody gets involved in the patient care. So that is where the progress of oncology has occurred in the past decade. Very simply, it's a holistic approach, and to the patient. Patient is not seen just a tumor sitting there, and he is seen as a person as a whole. And now we know that we can treat the patient, and he cannot be left to the society and without rehabilitating him, and that's also is taken into consideration while giving the treatment. It's a sequelae and to the patients. The Radiation Association, and in that we generally have annual, yearly once, the conferences wherein the experience of us will be shared and with the delegates who are participating, and we have a scientific program drawn out and where new things has come and we discuss them, how to bring that to the common man use and in the Indian setting. That's where the attention is paid. Also, the younger generations are coming, and a teaching program or workshops are always held one day and prior to the conference to tell them how exactly to go about treating the patient, and also technically how to contour a tumor, how to give a radiation. All those things will be discussed and with them. So in other words, it is basically it's an educational program every year we do. That's annual. But apart from that, we also call what is called as the Indian College of Radiation Oncology, and which specifically focuses on particular topics of interest to that particular season, and teaches the student for almost 2 days in various parts in India, and at least 4 such programs are held in India at any given point of at any given year. This is the second, the work that we have. The third that the association does is, and every month, and we publish, a journal. A journal is one written, the scientific material that is being distributed to everybody, every members of the association, and we the person who has done the research work and publishes it, and that is a good knowledge and to the members. So this is the third way under that we have, and also to go to the one step further, we also have an international collaborations and with the Asian radiation oncology community, and recently we had a meeting in Japan, and when Indian people have participated, also we have what is called our collaboration with the European countries, and we do it as AROI Istro, the teaching program. This time it's going to be held in Delhi in November. So, and also American, the association along with them, and we do a program. Last month we had it was in Mumbai called the ERO Astro program. So in that way, the scientifically we are giving a good knowledge to our members and want to teach and to learn. I can give you a very simple example. It is like we learning the mathematics. The 4 into 4 is equal to 16. And if you really don't know, and if you want to take a computer even for that and know directly 16, you will forget about 4 times is 16. So that basic knowledge has to be there, and with our budding radiation oncologists. For the same reason, and we have a teaching and a program meant for them, and also we post them to various the institutions, and even in the same institutions, to learn hands-on, manually learn that. It is not allowing only the computer to do it, but many times these days the data is so much, it may not be possible to do it manually, and we do need the computer to do that. But what is a basic what the computer is doing, and we should know. So in that way, it is being every stage it is being taught to them. Just give an example, because I work in HCG. Then I'll give what we have. A model is this. It's a 3-tier model. The first model is the basic model, and wherein we have a basic equipment to treat the patients, and the specialists are available for that. The next level or the mid-level model, and that is not available in all the places. The next the 2-tier cities, they have got that, and we put up the next level of the equipment or a technology that's available. In this case, I'll just add what is called the intensity modulated radiation, or called as IMRT or 3D CRT, we call it as. So that is the second level, and the third level is the top end or the tertiary level, and that is where we call it as the stereotactic radiotherapy or a cyber knife, and those kind of things comes in that level, 3 level. So in fact, that is the level, and we do need in India, and not only in private, even in the government level, we do need that, and then only we can optimally and we can make use of what gadgets that we have, not just to showcase them, but to really use them to the optimum utilization. The future of oncology in general, and radiation in particular, is going to be a personalized medicine. It is not just the giving the radiation, but the radiation being deposited without any harmful to any part of the body. Not only just depositing the quantum of radiation, even to enhance the same radiation effect to the to in a tumor cell killing. That is what it's going to be in from the radiation. Second, and how do we transport this radiation to that part is also developing very fast. The third, in the genomics, not all people are same, and how you react to radiation, how I react to radiation are different. So how do we really quantify that and then give only that adequate number of treatment for you? And that is the way we are going. And the fourth one is, sometimes the particular drug or a surgery or radiation may not work for you. So how do I combine with other drugs to make it work? So that is the fourth level of the work that's going on. In other words, it's a personalized medicine, and is going to be the future, and at least in the 5 to 10 years to come.